Understanding fatty liver disease and hepatocellular carcinoma, or HCC. Your liver performs many essential functions. For example, it helps remove toxins from your body and store necessary nutrients. Cancer that starts in the liver cells is called primary liver cancer, or hepatocellular carcinoma, or HCC for short. 9 out of 10 liver cancers are HCCs. In the last 20 years, HCC has become more common. One reason is the increase in a specific risk factor, fatty liver disease. About 30% of adults worldwide have this condition. Fatty liver disease is also called non-alcoholic fatty liver disease, or a newer term, metabolic dysfunction-associated steatotic liver disease, or MASLD. It is normal to have some fat in your liver, but when more than 5 to 10% is fat, doctors say you have MASLD, or the common term, fatty liver disease. The fat buildup makes it harder for the liver to perform its functions. Fat also leads to liver inflammation. Long-term inflammation can lead to cirrhosis, which often leads to liver cancer. As fat buildup from MASLD damages the liver, a more serious condition called MASH can develop. MASH stands for metabolic-associated steatohepatitis. This condition was previously called NASH, so you may also hear it called non-alcoholic steatohepatitis. Whatever you and your doctor call it, it's important to know that MASH puts you at greater risk of cirrhosis, which raises the risk of HCC. The term metabolic-associated signals that both these liver conditions are associated with metabolic syndrome, a combination of high blood pressure and blood sugar, unhealthy cholesterol levels, and extra weight around the waist. Metabolic syndrome is linked to heart disease, stroke, and other conditions, as well as liver disease, so taking steps to prevent and treat MASH can help your general health. Other risk factors for MASLD and potentially MASH include being over 50, although children can also get it, having Hispanic heritage, and having obstructive sleep apnea. Not everyone with MASLD develops MASH. Genetics may play a part in why some people do and others don't. Most people with MASLD do not have any symptoms until it is at an advanced stage. As the condition progresses to MASH, symptoms can include feeling tired, pain on the upper right side of your abdomen where your liver is located, and signs of liver failure, including yellow eyes or skin, retaining fluid in the abdomen, or confusion. It is possible to control some risk factors for MASH and help prevent liver cancer. You can lose weight, exercise, avoid alcohol and smoking, and control diabetes, high blood pressure, and cholesterol. If you have MASH, it's also important to get vaccines to prevent hepatitis A and B. If you have MASLD that may progress to MASH, your doctor will probably ask about your medical history and any conditions that could harm your liver. Measure your waist. Calculate your body mass index, or BMI, the amount you weigh for your height. Do blood tests to check liver enzymes, cholesterol levels, and any signs of liver scarring, as well as hepatitis C. And recommend a CT scan to check for liver scarring. If tests indicate you may have MASH, a specialist may take a small sample of tissue from your liver and examine it under a microscope in a test called a biopsy. If you have MASH and enough inflammation to cause stiffening of liver tissue, called fibrosis, your doctor may recommend medication. With diet and exercise, this may help reduce MASH and fibrosis. Your doctor may also recommend medications to help treat MASH and/or obesity. Researchers are working to identify more ways to treat MASH and prevent cirrhosis and HCC. If you have questions about HCC and how to help prevent it, Blue Fairy is a liver cancer advocacy and support group that can help. Visit bluefairy.org to learn more or find a support group.